as we go on, and when you the regimen that the two docs figured out was daratumumab, the dexamethasone, the Benadryl, and also Velcade, borotuzumab. And after the first treatment with the Dara and the Velcade, all of a sudden I had a sty in my eye. And I went to an ophthalmologist who prescribed an antibiotic and warm compresses and did nothing. Went back, they tried another antibiotic drops. Nothing. Now I've got a sty in my other eye. Tried another eye med, steroids. No use. I mentioned it to my New York oncologist, who said, "You've had your last dose of Velcade. It is an unwritten side effect, and it did not come out in the clinical trials, but we have seen patients with styes who were on Velcade, and when they go off, sure enough," he said, "in 3 weeks they'll be gone." 3 weeks later, they were gone. Just, part of the joys of all the fun things that you get with side effects of medications. Thankfully, after a year, which is the normal protocol, you go on 1 month of daratumumab, once a month, and the IVIG. And I have been doing that now for close to a year. But 4 months ago, 5 months ago, the company that makes daratumumab got FDA approval to give it sub-Q. So everybody gets the same dose, which is different from the infusion, which is based on your weight. And it is injected 3 inches from your navel as a subcutaneously, sub-Q. But it's 15 mLs of fluid, which is a lot to give sub-Q, and it has to be given over 5 minutes. Well, the first time I said to the nurse in the infusion suite, I said, talk to the pharmacy and have them split it into 2 shots, each 7.5 mLs, or give or take, and then inject on either side of my navel, and I won't have this huge amount of fluid in my abdomen. And that has worked beautifully, and now that's the way the pharmacy does it for everyone who ends up on what's called Fast Pro Dara. And that has cut 2 hours down to 5 minutes. And it can be done while I'm getting the IVIG. So, and that I have convinced them to speed up so that I get it over 2 hours now, because I've never had a reaction to it. So I'm down to 2 hours in the infusion suite once a month.